Hello there. Hi everyone. I'm Dr. Indrani Raman. I'm the founder of Excel Health MD. Thank you for joining me today. As you guys have seen for the last 2 weeks, we've been doing Facebook Lives. On Tuesdays, the focus is on holistic weight loss. And Thursdays, we're going to be focusing topics on functional wellness. The last 2 weeks, we have talked about immunity support, and especially during the COVID time, I felt that was what was needed for education and how you can naturally support your immunity. So if you have not watched any of those videos, go back 2 weeks and do look at those. There is a lot of beneficial information in there. So now today's topic is going to be really interesting. These are the top 5 dietary supplements that I'm asked in my clinic all the time. So the scenario usually plays like, hey doc, they come in with a bag of 5 to 10 supplements and they put it on the table and they ask me, hey doc, what do I need to take from here? And what do I don't need to take? Can you help me with picking a supplement? So we do provide personalized recommendations based on their health condition. And I figured this knowledge will be helpful to you also, so that you know what is needed, essentially in your diet, in your daily life, even if you don't have any health condition. So which supplements might be beneficial. Now, before I even go into the supplements names, you might ask me, why do I need to know about the supplements? I mean, I'm eating healthy, I'm eating diet, am I not getting the enough nutrition in my diet? So sadly, the majority of Americans are not eating healthy, and our standard American diet is so poor in the nutrients, especially with all the environmental pollution that happens, the GMO products that are out there, and the processed foods. So due to all these conditions, we are not getting enough nutrients to absorb in our body. On top of it, a lot of people suffer with inflammation in the body. So with all the gut health issues that are happening, they're not even able to absorb all the foods that they take in. And let's face it, none of us are eating 4 to 6 servings of vegetables every day. So there is a role for supplements. It's an easy way to increase your vitality, and it's also easy way to replace any missing nutrition. They also play a role in chronic disease management and prevention. For example, if you have any history of osteoporosis, you will benefit from taking vitamin D with calcium to prevent the risk of fractures. And those of you who are on proton pump inhibitors like Protonix or Nexium, you're not absorbing magnesium and B complex, B12 vitamins. So you really will benefit with supplements like that. So there is a role for dietary supplements in our daily life. I also want to bring in another caveat that these are loosely regulated by FDA. So you have to be always be aware of the contaminants and adulteration that happens. There was a law that was passed in 1994 which is a Dietary Supplement Health and Education Act, which does tell them to maintain certain standards, but it is based on their own, they are based on their own honor system. So FDA will step in if there is a severe adulteration issues or any complications, or anything like a liver failure, or people have severe damage. FDA will step in, but most of the time they are not really regulating the industry. So you have to be aware of, you have to do your own research, guys, and read labels, and then try to buy directly from a manufacturer, and avoid the third-party sellers. In that way, you can at least know that there is less contamination and they are not out of stock bottles that they are selling to you. In our practice, of course, we do know the brands which are good manufacturing process there, and we also know the quality of the ingredients, and also know the safety standards of some companies that we use. So we are able to provide a more direct and personalized recommendations for everybody that they can take. So do your research and read your label and be careful of what you take in. So I also want to clarify, this is my lives is only for when I talk to you guys, it's mainly for educational purposes, and this is not medical advice. If you need my help and need more detailed consultation, do call our office or make an appointment with me. Happy to help you. So my first dietary supplement that I want to talk to you guys is mainly about fish oil, also known as omega-3 fatty acids. So most of us are not getting enough of this, and our American diet is this, the balance is out of whack between omega-6 and omega-3 fatty acids. And omega-6 is a pro-inflammatory marker. That means it will put you at a risk for heart disease and inflammation in general. So having a good omega-3 supplement will help you to reduce the inflammation in the body, decrease your risk for stroke, and decrease your risk for heart disease. And also, if you're pregnant and breastfeeding, definitely you do need that for the baby's brain development. This is an important aspect. Now, the most common source of this omega-3 fatty acid is mainly from marine sources, like fish like salmon, and also sardines and mackerels. Now, if you are a vegetarian, you will definitely need to supplement these nutrients. You can get it from plant sources like walnuts and chia seeds, flax seeds. You can also take a algae oil, which will also be able to help give you the same amount of omega-3 fatty acids. If you're not able to eat all these other plant-based products, you can take the algae oil supplements. The common dose we recommend usually is 1 to 3 grams per day. If you're going to go for any surgery, or if you're already on blood thinners, you should be careful with the interactions because it can cause increased risk of bleeding. Some studies show that there is no risk, but in general, just better be aware of that. So always, with all the dietary supplements, be aware of any drug interactions, and always check with your own medical doctors to make sure that there is no problem with taking a supplement. My second supplement I would talk about is, it's magnesium. So magnesium is responsible for almost 300 reactions in the body. So it is responsible for mood regulation. It can cause blood sugar imbalance. It is also responsible for high blood pressure, for heart rate irregularities, mood swings, and also especially premenstrual syndrome. Your cramps, the fun fact is, if you're suffering severe PMS symptoms, take some magnesium along with B6, and you will see a reduction in the severity of the symptoms. So it is really very commonly depleted, and 75% of Americans are not eating enough magnesium in the diet. So this is a very common thing that I really put everybody on in our practice. And an average recommended dose is at 400 milligrams per day. I do prefer magnesium glycinate or magnesium citrate because they have least GI effects and they are better absorbed by the body. The only caveat with magnesium is that if you have any history of kidney disease, then your body is not eliminating enough magnesium, so you should be careful and the levels need to be monitored. Magnesium also helps a lot with any restless leg history. You can always try this supplement, see if it helps leg cramps. And if you're on a water pill for control of your blood pressure or any of the reasons, you will be deficient in magnesium, because some of the water pills can deplete you of this. So that's my second one for you guys. Okay. The next one would be vitamin D. So this is a good this is a good vitamin that is also responsible for so much hormonal regulation in the body, and also a lot of immunity support comes from vitamin D. And there is a good chance that most of us, 80-90% of us, are deficient in vitamin D. We are not so much outdoors and using our sunscreens and such. We are not absorbing enough vitamin D in our body, so we really need to supplement that. Any deficiency of this can cause symptoms of depression. It can also affect the glucose metabolism. A severe deficiency can cause bone fractures, and rickets syndrome is seen in children, and fractures and falls in adults also. So I really like to combine vitamin D with vitamin K2 and also calcium, so it is absorbed better. A commonly prescribed dose is somewhere around 2000 units per day. Number fourth dietary supplement is probiotics. So a lot of Americans nowadays suffer from digestive issues. We see this very often in our clinic. There's a lot of gut health problems. The symptoms can present as severe constipation or irritable bowel syndrome, diarrhea. There's also nowadays more increased incidence of inflammatory bowel diseases. So the gut health is really a big major complaint for majority of patients nowadays. And there are several factors that may be playing a role in this. Sometimes it could be chronic use of antibiotics, or more recent use of antibiotics that can affect it. Yeah, or if you're also on prolonged intake of medicine like non-steroidal drugs like Motrin and ibuprofen, that does affect your gut health. And if you have any food sensitivities, allergies to any of those, and also increased stress levels, it does affect quite a bit with gut health. And poor nutrition and processed foods, all of these are a causative factor why you probably need to take a probiotic. So I definitely tell everybody to start at try the probiotics. There are several brands on that. If I have to go into the details on each one, each type of probiotic, it will take me a while, and it's a whole different topic. But I would just tell you, go with any brand and try using it 2 to 4 weeks, and see if your symptoms improve. If not, then you can always come and see us, or any functional medicine doctor. Our main role is improving the gut health. We also have a long program where we teach people about detoxification and gut health and nutrition, and we try to empower them with the education part. So probiotics are a big deal. Now you can get the beneficial bacteria by eating certain foods like fermented foods, especially sauerkraut and kimchi. If you like to do that, and also definitely increase more fiber in your diet, which kind of is like a prebiotic, and it also helps to improve more of your keeps the gut microbiome more happy, and you're providing food to them. Okay. The last but not least is taking a multivitamins and B complex vitamins, especially as we age and go into 40s. I would really recommend anybody to take a multivitamin. Now, there are 8 B complex vitamins which regulate so many things in our body. They're responsible for mood, digestion, sleep. They also are responsible for any kind of anemia, low blood counts, even heart function too. So especially if you're on the proton pump acid reduction medications like Nexium or Protonix, you're not absorbing enough B12. So you really need to have B12. And it's also important for your brain health. And we know about the folate for especially women who are trying to get pregnant to avoid any birth defects. So that should also be there as a multivitamin. So if you had any weight loss surgeries, bariatric surgeries, and you're not absorbing also enough B complex vitamins, so it really should be a part of your daily intake. So I think that's all I have for you guys. Those are the 5 vitamins, dietary supplements that I really recommend that everybody should consider adding in their daily life. If you have any questions, you always post comments below. And if you want me to talk about any topics that interest you, then definitely send me some suggestions. I'll be happy to discuss them and talk to you. If you're interested in more personalized recommendations, do call our office and or go on our website and make an appointment today. If you think this has been useful to you, please like and subscribe our page and share with your friends so they also might benefit from this. Thank you guys. Have a